Hi everyone, my name is Rigel Bacani and today I am presenting reporting of patient-reported outcomes in RCTs focused on tinnitus, a meta-epidemiological study. Tinnitus has a widespread influence on patient quality of life and is a difficult and chronic disease to manage. It has profound direct costs in the way of accessing healthcare to evaluate and treat it, and indirect costs due to missed work and loss of productivity. Currently, there is no cure for tinnitus, so interventions currently aim to reduce symptom severity and increase quality of life, as well as allow people to return to work and their daily activities. In addition to not having a cure, tinnitus currently has no objective measures for diagnosis or symptom severity. We currently rely on patient-reported symptoms to both diagnose and evaluate the effectiveness of our treatments. As such, it is imperative that we create a patient-reported outcome that not only evaluates symptom severity and frequency, but also patient quality of life, their psychosocial wellness, and functional outcomes. With PROs being the primary tool used to evaluate the disease course and the efficacy of treatments, it is imperative that these tools are standardized and backed by solid evidence-based practices. These PROs should seek to include multiple domains of the patient experience and not just have a simple measurement of symptom severity. The Consolidated Standards of Reporting Trials, or CONSORT, is a reporting guideline and checklist used for randomized controlled trials to encourage transparency in reporting. CONSORT added an extension to their checklist for RCTs using PROs, which recognizes their increasing use in clinical research. Our team screened over 800 studies across several databases for tinnitus randomized controlled trials that evaluated PROs as their primary outcome. The studies that were included underwent full text extraction using a pilot-tested Google form. The Google form used an adapted CONSORT-PRO checklist. Our primary objective was to assess the studies for mean percent completion. Our secondary objective was to evaluate for relationships between percent completion to specific study characteristics as shown in Table 2. Further, we used Cochrane's risk of bias tool to evaluate these studies for risk of bias and its relation to percent completion. All screening and data extraction was done in mass duplicate fashion with a third party to resolve discrepancies. Of the articles we screened, 37 met our inclusion criteria for full text extraction. The mean CONSORT-PRO completion was 51.17%. Bivariate analysis showed that RCTs published after the 2014 publication of the CONSORT-PRO extension did not have a higher completion of reporting. Study characteristics that were associated with higher completion were mention of CONSORT in the article, trials with some concerns of risk of bias, and trials with low concern of risk of bias. In contrast, items that were infrequently reported were mode of administration of PRO questionnaires, statistical methods of obtaining sample size, and demographic tables including baseline PRO measurements, and PRO domain reporting. Overall, we found a poor adherence to the CONSORT-PRO checklist in tinnitus RCTs. These deficiencies were most notable in reporting of specific methodological and statistical items, as well as in the study results. This incomplete reporting can bring into question the validity of the PROs chosen to be used for the study, as it is unclear how the PRO was used and on what population, which affects its standardization, as well as the generalizability of the evidence within their RCTs. Our results show specific areas for improvement, such as the endorsement or requirement of CONSORT-PRO checklists by journals and their instructions for authors. If you have any questions over my presentation, I would be happy to take them. My email can be found below. Thank you for your time.